So take a concept of low-level lasers, and again, you have to accept the fact that this is a science that has been around for a long time and actually does something. And there's going to be a group of you that will say it does nothing, and there'll be a group of you who have no idea what I'm talking about, and then there'll be a group of people that says, yes, this is real science. And the concept here is that we can use this kind of technology to remove fat from the body in a painless, zero downtime, zero surgical procedure. And again, if you came to me and said this a couple years ago, I would say you're crazy. But again, you have to sort of go back to the science. So we're using a 532 laser to stimulate the photoreceptor, which is the fat cell that absorbs light. It influences photoreceptor function of the fat cells, and it activates a secondary cascade, which creates a temporary pore in the fat cell. And if you get a temporary pore in the fat cell, you can release the contents, and that those free fatty acids can easily be absorbed, removed from the body. So these are the most important bullet points. The application of low-level lasers, whether electrical, ultrasound, or light, for anything, has been met with an amazing amount of skepticism. We believe that, and we were taught, stronger or more is better, and if you don't have any pain associated, we're not going to work, and that low-level energy represents a placebo effect, or even voodoo or faith healing. And there's enough clinical data that I'm going to try to share with you to show you the science behind this and that it works. So we know that low-level light, such as low-level laser light, can penetrate skin. And it can penetrate deep into the skin. And we've actually been discussing this for almost 20 years, okay? And that it's called photomodulation. This is not photothermal or photochemical, it's photomodulation, and it can affect at the cellular level. So that's the basic premise that you have to sort of give me as the basis of what we're doing. We are affecting things at the cellular level, and we can modify cell activity and response because these devices and this kind of low-level laser can penetrate deep. So there is a response, there's a big pathway, cell signals that get introduced and modified. Again, we don't have time to go through all of this. ATP is very important in this. But if you look at what low-level laser therapy applications can do, and they're being studied for all of these applications, wound healing, tissue repair, inflammation reduction. Low-level lasers are used in pain relief all the time, various neurological disorders and inflammatory dermatoses, but it also can be used for fat reduction. And again, various different wavelengths have been studied, and the current thing that we're using right now is a 532 nanometer system.